back techniques, laying on your side. The reason it's very valuable information laying on your side is because sometimes when you're laying on your stomach, the person has lower back pain really bad and they're very uncomfortable. So some of these techniques will help. If you do these first, then the person can maybe lay on their stomach. You don't have to be a therapist to be able to master some of these techniques, honestly. If you just follow along, work within your, the person that you're working on's comfort level. Don't push too hard on things, ease in, I found that sometimes people won't take as much pressure from somebody they know, so they probably do need to come in and get a massage. But just in the meantime, if this could be some, good information for you guys. Also, if you're a therapist, this will help you as well. So just hang on 1 second. All right, now that we got her on her side, so what we're going to do, a lot of people who have lower back pain going to be focused right in here, or it can be along the bone through here. We have her on her right side because her left side hurts worse. Sometimes that's due to because we tend to put more weight on our left side because our right leg is maybe our action leg. So you can take a lot of, a lot of the damage. So what we're going to do, the first couple steps, I know like for me, for lower back pain, I actually feel it on top of this bone through here. So what I like to do is I'm going to put her knee up a little higher and have her scoot towards me a little bit. So there you go. If you'll watch one of the prenatal videos, I do some of these techniques. But what I like to do first is I'm going to put my forearm along this bone. Now what I'm not going to do is I'm not going to put my elbow down in there because, I don't want to be kicked. So, and you may need to move a little bit just to be able to see. So I'm right on top of that bone. So what's going to happen is I'm not pressing at all right now. But when I lean in, what I'm trying to do is I'm trying to get under the bone and down inside the hip. Now, obviously, I'm not going to do that because that would make her scream. But what I like to do is kind of sink in and lean. Now, what you're going to have them do is take some deep breaths. And as they start to, now what will happen is as they're breathing, it's going to get a little bit easier. And then as they breathe in, take a deep breath in. And when they breathe out, you just sink in a little bit. All right. I can tell she's pretty stiff. So we're just going to, you try to hold that for a little bit. Does it feel pretty tender? Are you okay?
I'm okay.
All right. If you needed to go deeper, what you could do is, and I'll show you on the other arm, is raise your hand up, which is going to put more weight into the bottom of my arm, which will cause some more pressure. But do you feel like that's a good pressure for you?
Uh-huh.
Okay, so she's like, don't do any deeper, you're good. All right, so then what I like to do is walk my way, and here it gets a little more tender as you can hear her breathing, and just sink in. Great techniques. So these, sometimes what happens when you start putting pressure on an area, it's going to reduce some of the blood flow into the area, which causes the muscle to be able to relax. Reduces inflammation. Some of these are good trigger points. You don't know what a trigger point is, or a trigger point massage. It's where we really get those sensitive areas and target them, where the muscles get the tightest. Do you feel like pain's going down?
A little bit.
A little bit. What she doesn't know is I've actually sunk in deeper a little bit more at a time. I'm not just going to start deep. Okay, and then we're going to work our way through the back. Now, like in massage school, for some reason, at some massage schools, they teach not to actually work on the sacrum, which is the bone right here, just so y'all know if you need to see. So the reason they probably teach that is because there's a lot of liability for that. But if you do it right, and you work within the client's comfort, you'll be okay. So what I like to do now is maybe get a thumb, put one finger in front on top of the other, and don't use your upper body and your thumbs. A lot of people wonder, how do therapists do this all day with their thumbs and not break them? Well, that's because we don't just sit there and push with our thumbs. That's how you burn out your thumbs. What I like to do is just put some weight and then lean, and she'll feel it. You feel that? Excuse me. Does that feel like an area that usually bugs you?
Mm-hmm.
So what I like to do is what's called an active release. I'm going to have her bring her knee towards her chest. As I'm digging in. There you go. She need the rest too. And release. And we're going to get lower into the sacrum. Up. And release. Good. Next, we got this bone through here. You got the sciatic area right here. If you got sciatic pain, this is going to help too. But we're going to do the same general idea. I like to get a good position along the bone. The bone's through here. And sink in. Work within their comfort. If they don't, listen to their breathing. If they start breathing in deep, it may be like, okay, that's getting a little deep. Therapists aren't mind readers all the time. We tend to listen to you. We just tell you we're reading your mind. It makes us sound cool. All right, and we can do another active release. And I'm gonna have her bring her knee towards the ceiling. And go down. Good. And then we're gonna work our way lower. When they go, you know you're in the right spot. Go ahead, lift up. Down. Good. Now remember, I'm not necessarily using all my weight into the elbow. You can use a little bit of this instead. That way you're not hurting them. What I also like to do, I do like to do some side lying hip flexor stretch. So what we'll do is you'll sit right behind their hip, provide them some support, lean in. I'm going to grip here. Now what I'm not going to do is just pull the knee, because people have knee pain, that can hurt them. I'm going to hold them like this and just lean this way. You feel that?
You can keep going.
Okay, she likes it. Usually feels pretty good. And then when you get to a deep part, you can start bending. And if you feel that in your knee at all, we don't want to do it. Really good stretch. All right. Lastly, what I want to show on this video specifically, a lot of people who have pain, definitely in their hips, lower back, a lot of times what happens because we sit a lot in society today. I'm going to take your shoe off for this. But when we sit a lot, if you do that all the time and you never activate your glutes, your brain can turn your butt off. So we need to learn to activate that muscle. So I want to teach them how to activate it. That way they're walking better. I've been told by clients, once I taught them this, they started activating it all the time, and then they were getting sore. They knew they were doing it right. And so what I'm going to do is I'm going to lift her knee up. I'm going to put her right into my hip. I'm going to lift up, get a good grip on her, hold, and then what I'm going to do is I'm going to have her push a little bit. Don't throw me into the wall. Push a little bit with your heel towards me. Now, when she's doing, you keep going. When she's doing that, she should feel it here. Mm-hmm. And you feel that there? Mm-hmm. Now, that means she got strong glutes. Now, if they don't feel it there and they start feeling it up here,
it's a little bit there too.
A little bit there. But so when she's doing it, make sure you keep pushing until you finally only feel it there. What that's going to do is going to teach your brain to activate that muscle and use it properly. And one technique I like to also do is have them do bridges. If you don't know what a bridge is, I'm going to show you real quickly. We'll have you lay on your back.
Okay.
And pull that down. There we go. Again, through your heels when you do bridges. What I have you do is I'm going to have you raise your pelvis up through your heels. You feel that? Go ahead. Engage your core, protect your lower back while you do that. Go down. Good. And then you'll practice doing that. If you get good at that, I'm going to show you the next step. Go up. Now I want her to put all her weight on her right leg. Now raise her left leg up and down a little. She's like, I didn't know you were going to work out.
Could probably use it.
Yeah. And then we're going to switch and do the other side. This is an amazing workout for your glutes, for your abs, all the above. Very good, and it's very low impact. All right, are you feeling a little better? Good. She's just saying that for the sake of the video, but now there's more advanced techniques that we'd actually do as massage therapists. So if you are in pain, this may get you through a little bit, but we want you to get in and see us. Thank you so much for watching. If you just click the red link below to subscribe to our channel, we have some other great videos. If you have any suggestions, comments, questions, anything, we'd love your feedback. So thank you again, and y'all have a wonderful day.